Meconium aspiration syndrome. Meconium aspiration syndrome is mostly connected with the short for gestation age babies and intrauterine growth retardation baby or the low birth weight babies who aspirates the meconium, which is passed during delivery time into the amniotic fluid, and later after the birth they develop respiratory distress. Now in these babies, resuscitation is done when the baby is delivered, immediately covered in the pre-warm sheet, and suctioning is done oronasally, first orally followed by the nasally, so that the meconium aspirated can be sucked out through the aspiration. But when there is respiratory distress is more, then a skilled person in the intubation should be available, so he can immediately perform the endotracheal intubation and tracheal suction when there is heart rate less than 100 beats per minute, muscle tone is not good, severe respiratory distress like gasping is present, and no crying is present. Then after intubation we perform the endotracheal suctioning, and if needed mechanical ventilation is provided. But when the baby is normal, crying is present, heart rate is more than 110 beats per minute, and muscle tone is good, but baby has aspirated some amount of meconium, then suctioning or the stomach wash is done properly, which is done by inserting the Ryle's tube or the orogastric tube through orally, by which we will suck out all the meconium absorbed by the meconium which is engulfed by the baby, and stomach wash is mostly done by the normal saline method. Then further, what are the lab investigation done in a baby born with the meconium aspirate syndrome? Chest x-rays are done, complete blood profile are checked with blood grouping. In chest x-ray, what are the findings? There will be flattening of dome of the diaphragm, also hyperinflated lungs, pulmonary infiltrates can be present, and segmental collapse when there is severe respiratory distress. Now, as I have discussed management earlier, when the baby is in severe respiratory distress, then intubation and mechanical ventilation is provided, and when the baby is normal and meconium is aspirated but in some or moderate amount, then suctioning is done or the stomach wash is done. Further, we will also give the fluids to the baby if there is fluid depletion in the baby, and when there is symptoms of infection like fever or increased muscle tone is present, we can give antibiotic to the baby. And most common antibiotic used in neonates are amikacin. Thank you.